Hi, my name is Gloria Wu. My past iteration was YouTube video with Health Talk with Gloria Wu. Then COVID hit and we took a hiatus. And this is our new show. It's a segment. And we're going to call it Friday Reports. I hope you'll join us. Today we're going to talk about diabetes, the social determinants of health, and virtual assistant devices, which I think is going to help us all. And with me is my friend Sean Aslam, and we're just going to hang out and chat with each other about this big topic.
Right. So something that I thought was interesting is the idea of the emergence of VADs or virtual assistant devices, and how they're starting to kind of bridge the gap when it comes to health disparities with specifically our minority patients. And I think it was just so big and so, I guess I would say obvious how important that stuff was, how important virtual assistant devices were during COVID.
Yeah, I think that COVID was a great equalizer because everyone stayed in, everyone was shut in. The doctor's offices were closed for a while, and now they have partial hours, and even many doctors aren't seeing patients in person. They're only doing Zoom or telehealth or FaceTime videos with their patients because there's such fear of Omicron, the variants and everything. So I think the virtual assistant devices are good in the sense that we tried out Google and Amazon Alexa, and we found that you could ask them many questions and they do respond. Siri surprisingly only gave us websites. So Google Assist and Amazon Alexa were the most robust. They talked back and it was understandable. And I think for diabetes was very useful because it's a chronic disease. You need education. And sometimes if you're locked in during a pandemic and you've lost your job, you have no transportation, you can't get to anywhere. This is a good solution.
Right.
Yeah.
Right. And that's something that even I think was so interesting with 85% now of the total US population owning a smartphone, and all of those smartphones having actually a built-in virtual assistant device, whether that's Siri or Cortana, or whether it's Google Assistant, which is, I think it's Siri number one, then Google Assistant. And even furthermore, there's Amazon Alexa, which obviously is not that's built into any phone exactly because Amazon doesn't make a phone, but
free app.
Right, yeah, it's free. And with this advent of like smart home or the Internet of Things and smart home technology, I think Alexa is actually the most ubiquitous amongst all of them. And you can ask it some pretty robust questions when it comes to, for example, like diabetes, or when it comes to health, and it relates important and pertinent information.
I think it was shocking and amazing and fabulous that Amazon Alexa partnered with hospitals so that patients could talk to their doctors, find out what their meals were like, and everything. So it was great, and it was free, and maybe the hospitals had to pay for it, but certainly it bridged the gap. And Amazon Alexa also has a subscription service where they will tell you if grandma fell or it was inactive for so many hours, and you have to think that maybe somebody fell down. And so I think that's brilliant. I think that's going to be so helpful during the pandemic where you cannot get a lot of caregivers to go to the house, or even if they're being used in nursing homes and assisted living facilities, there's a chronic labor shortage. So not everyone is getting the home health care that they need. There's just a labor shortage. So I think this is going to bridge the gap, and especially with people who have limited income because they lost their job during the pandemic, or they're sick, or they're taking care of loved ones and they can't go to their job. I think that they can access educational information about diabetes. For example, what should I do if I can't see and I have diabetes? What should I do about my insulin requirement? Can I get coupons on GoodRx? I think this is an excellent way that our society is progressing using AI. I think it's a forward movement, and I'm glad that we're going towards this way as a society, because it's a great equalizer.
Right, right. How do you think that actually, with the advent of like AI and VADs, that's gonna in the future change the patient-doctor relationship?
Well, I think that it already has, because of the pandemic. Nobody saw their patients in a timely manner. So now, as a physician ophthalmologist, I see a lot of patients who did not take care of themselves for 2 years, and they're now coming in with severe eye illnesses. But I think for people with chronic diseases such as high blood pressure, diabetes, where they could not see their doctor at all, they're coming in with more severe diseases. So I think these virtual assisted devices can bridge that time period rather than, it's better than nothing. And I think the large companies, Google and Amazon, Alexa, Apple, have done a good job. I think it's bridging a gap. And I think in the future, we'll all be embracing this type of technology. We need it because we can't possibly see all our patients all the time. And this helps them feel that they are in communication with a healthcare provider, be it myself, a nurse, or somebody, so that they don't feel so isolated and fearful of their disease.
Right, right. And something else that I've kind of like noticed, even just generally, I think like even I do, and I think I would say most lay people do, where, obviously going on to Google to check up symptoms, which I feel like sometimes can become a runaway train if you're not properly trained, of course. But when it comes to general information as to, for example, like, what the difference between type 1 and type 2 diabetes are, things that actually I think, unless you're dealing with it specifically, the layperson wouldn't exactly know. It seems like VADs are starting to educate the public in a way that actually makes it probably easier for you to be able to communicate with the patient.
I think it's excellent. I think that as more users use these devices, all these companies have artificial intelligence software, so they are using the responses to refine their future responses, when they can talk back to the patients. And in a way, some people find that intrusive because probably everything is taking in, you lose your privacy, you're probably, your name is, decoded and we don't know who you are. But nonetheless, the type of questions being asked of Alexa or Google are probably being recorded. And I think in the future, the response by these devices will improve.
Right.
I don't think it's perfect now. Of course, it's good to go to your doctor. But right now, the pandemic is still with us. Not everybody is able to get to the doctor because some doctors still have decreased hours. Not everyone's fully open. And many of my patients have told me they cannot see their internal medicine doctors. They only see them on Zoom. Nobody's actually laying hands and, touching them and looking at their, hands and their body and feeling their abdomen or listening to their heart anymore. It's this awkward time of the pandemic.
Right, right. And then lastly, something I was also thinking about, something that's been on my mind, is this idea of how do you think it's making inroads or helping our patients specifically with health literacy? How do you think, what kind of impact do you think VADs are having with that?
We were doing this study and we found out that unfortunately most of the VADs, Alexa and Google, are at high school or higher education. Alexa is a little bit better. They're 7th and 8th grade. And something like 54% of the American public have a 6th grade education or lower. But I think that as more users use this, they will change their vocabulary and it'll be more user friendly. And it's unfortunate that, accessing health data requires a higher reading comprehension. But that's the way it is, in the sense that we can't explain diabetes in one word. But I think these VADs are helping because somebody in their family can then take that information and explain it further, or at least say, go to a doctor, or at least go to urgent care, or go to the ER. And I think that's excellent because some people don't know what a heart attack in a diabetic may mean, because diabetics with chest pain don't have regular chest pain like normal people. So they have, maybe they feel nausea and they don't feel left-sided pain. They don't feel pain radiating down to their arm. So I think this is a big advance. I don't think it's perfect. I think it's the beginning. And as a doctor, I want to embrace it and have my patients embrace it so that we can get more robust future iterations. And I think that will happen. I mean, I don't think it's perfect, but I think it's good that we have this in the pandemic. Because if we had nothing,
Right.
it'd be very bad. It'd be like information blackout.
Right. Right.
That'd be, and this is really good if you're elderly and you're wheelchair bound and you can't get somewhere. It talks to you, and if you're totally illiterate, it'll talk to you in whatever language. For example, Spanish, Chinese, and some of them have Korean. So it's a fascinating time we live in.
Mm-hmm. Well, thank you so much, Doctor. I think that was very elucidating. I think talking especially about something that is so ubiquitous, especially with this current generation and in the United States, it's like 85% of people own smartphones, 97% own a phone of some kind. So it looks like it's like this brave new world of health literacy and being able to bridge that gap. Always of like, giving the right kind of care. So
Yeah.
I think it's really cool.
I think, yeah, so join us next time.
Yeah.
Thank you.